The Center for Wise Practices in Indigenous Health is a place where all Indigenous peoples, patients, learners, practitioners, researchers, community members can come to feel supported and welcomed on their healthcare journey.
So there's a research arm, and then the education focus, and then the clinical, the patient-facing work.
And it is meant to be a place of belonging, and a place where through that belonging we're actually pushing the healthcare system to think about what does it mean to become a safe and welcoming place for Indigenous peoples.
It's important for our hospital to host the Center for Wise Practices in Indigenous Health as a demonstration of our ongoing commitment to reconciliation with Indigenous people. In this beautiful space that has been co-designed and co-created with members of the Indigenous communities locally, this is a physical demonstration of what it means to enact reconciliation, to provide a space of cultural safety, of wellness, of health promotion for Indigenous people.
The center is extremely important when we look at the experiences of Indigenous peoples in the healthcare system. Many First Nations, Inuit or Métis peoples will enter into a hospital or a clinic setting and not receive the same high quality care as others.
There's a lot of literature that speaks about the ways in which when Indigenous folks come into the hospital setting and they're met with stereotyping and discrimination and unequal care, it can actually push folks to not come into hospitals and receive care that is critical. Cultural safety is absolutely a matter of life and death in a hospital.
We have someone who's an Indigenous peer support and Indigenous relations advocate, so you can be accompanied to your appointment.
So to have someone who's there, who's ready to stand up for you, to advocate for you, or just to sit with you in the waiting room or while you're having your appointment is so important.
One of the things that I'm most excited about at the center is the access to seeing a traditional healer or knowledge keeper elder.
When people present, they have the right to receive culturally appropriate care that addresses their needs.
You're able to come to the center and engage in these traditional Indigenous practices like smudging.
One of the reasons we smudge is to clear our minds, our hearts, of any outside negative influence that might change how we view the world and change how we feel.
We are thinking about the next generation, and so that means we are running youth programs. Currently, we're supporting 18 high school students, all Indigenous peoples, who are actually in the center learning about what does it mean to have a career in healthcare.
Donor support is so important. To be able to continue doing this work and to grow this type of work.
So much of what we have done has been through the amazing support that we've had from the philanthropic and donor community. It's been truly transformative. I'm really looking forward to seeing that next stage of healthcare and health transformation.